So, and it's not, you know, most of the time when I see an MRI, I can tell you instantaneously, this is what's going on, this is what to do. His is a bit tricky. I think we have a pretty good idea of what we're dealing with, but we're not 100% sure. You're going to have to figure this out. What we see on his MRIs here are these changes. These are slices of the brain stacked on top of each other. And that's his right eye, his left eye. This is his right ear and his left ear. So it's kind of like we're looking up from his feet and taking slices. And what we see is that this side right here looks normal. And then you see all this white stuff here. And as we come up, this white stuff sort of continues and it's just sort of tracking along in the brain.
Spreading.
And if you see on this side, we kind of have these little nooks and crannies. And on this one, it looks more full. And when we see that, we think that there's some sort of infiltrative process, as if there are cells that are growing and are filling the space. And you know, he looks a million times better than his MRI does. And when you see that, you say, all right, well, that means that this thing has been creeping along for a while. Because the brain does pretty well with slow changes, it does very badly with sudden changes. So for you guys to start to see symptoms, it had to get enough of this stuff to start affecting his brain. But I would think that this has been going for many months, has been building up. And the big question is, what is it? And when we look at things like this, we think in terms of categories. Could it be some type of tumor? Could it be an inflammatory response where the brain is attacking itself? Could it be some infection? And all of those things are sort of on the table when you have this sort of strange MRI. But you know, our thought and our radiologist thought is that this most likely represents something called gliomatosis. And that may be what Dr. Zarzor talked about. And what that is that it's a type of tumor where one of the cells in the brain went haywire and started to divide. And it's just slowly producing more and more and creeping through the brain. The challenge with this is that it's not something that we can go in and cut out of there because it's so diffuse, it's in so many places. But what we would want to do is give some sort of treatment that would try to treat the whole brain and go after the tumor cells, but not and leave the normal brain behind. So that usually is radiation and then one of the chemotherapies or molecular targeted aid, the newer drugs that we have. So
is it cancerous?
So most likely this is a type of cancer, a type of brain cancer. It's a very rare version of this type of brain cancer. And that's my best guess right now. But I can't look at this and go 100% that's what it is. And we can't be wrong. We have to treat it with the right stuff. So if it was that tumor, the gliomatosis, you would treat it with radiation and certain chemotherapies. If it was inflammation where the body was attacking itself, then you would treat it with steroids or stronger drugs to quiet the immune system. So we're at this crossroads. And really the only way to know for sure is to get a biopsy of it. You can do some other testing. You could do lumbar punctures and test the fluid, but I suspect that after all of that, it's all going to be negative. And I would recommend we just get a piece of this. I think that's the fastest, best way.
So the probability of it being this glio is high?
It's high.
Okay.
Yeah. Not where we could say that's definitely what it is. And
the procedure would just be to get a small biopsy surgically,
yeah,
and then do the radiation chemotherapy.
Yeah.
At his age, what
So unfortunately, this is such a this is not how these tumors usually grow. They usually grow like a ball. His is just very widespread.
Do you have any idea why in this case it would?
We don't know. We don't have enough numbers to really understand. We don't really know why the other, with the more common version forms, and we don't understand why sometimes it's this variation. There are, I've seen some people where this progresses extremely rapidly, and within, months, even with the radiation and chemotherapy, it's continuing to grow through it. I've also seen people that look like this, and we've treated them, and we're years out, and it's staying steady, and they become less confused. But we don't.
Even at this rate that you see him.
Well, yeah. I mean, he like I said, he looks better than his skin. He's confused. He's got some vision problems, which is what we would expect. But he's moving around. He's wide awake, and oftentimes people with this come in a lot worse shape. So you guys did a good job of getting them in. Unfortunately, we just don't know until we treat it and then we watch it. First step is to establish the diagnosis. He's on a biopsy is very routine surgery for us. Small incision, go in there, get a piece of it. Pathologist look at it. Very low risk. Problem is he's with his heart history. He's on the blood thinners right now, and we have to let those blood thinners wear off. So what we're thinking is that early next week we would go in there and get a piece of this. Unfortunately, I am away next week, but we have 4 doctors here that only do brain tumors.
That was my next question. So based on what we've heard, Dr. Judy, I believe.
So Dr. Judy is I spoke to him, and he's happy to take over and would be able to do the biopsy, Monday or Tuesday, once everything wears off. Okay.
Okay.
So, he'll probably come in and talk to you a little bit. It's scary. It's scary stuff. But what I'm hoping is that this has looked kind of similar to this, and it's been just slowly going on. And if we can get this zapped or whatever we need to do, we can quiet it down, get him feeling better.
What are you going to tell him?
So, what I usually, I think we don't want to scare him too much.
Right.
What I'm going to tell him is that we see something going on in the brain that we have to figure out. We're planning on getting a small piece of it, and then we'll take the next steps depending on whatever it is. Okay? Does that make sense?
Yeah.
It does.
Because he really doesn't feel like anything's wrong. Do you know what I mean?
There's no
Yep.
pain. There's no discomfort.
Yeah, no, and I think it's just interfering with the brain's ability to process complex things.
And I'm assuming it's in his stroke. He did fall about 3 weeks ago. He said he didn't hit his head.
Yeah, that all, we would see that on there, nothing bad going on.
So it's nothing we could have done differently. Nothing that we could, have noticed before.
And these, like I said, most of the time people come in much worse because it's such subtle things, and it's not where you're like,
You don't think
wow, not moving that arm or something like that ticks people off.
And I know that doesn't change anything, but
And I don't think it would have really affected anything of what we would have done. We'd have been in the exact same spot.
Okay, so this isn't obviously an emergency type situation. It's there. We just have to figure out what it is and then
Yeah,
treat it.
I mean, in theory, you could go home and come back next week if you wanted to do that. It gets a little tricky to get you back in.
Yeah,
I would just let him stay under
Yeah,
your
I
care.
don't think she's capable of taking care of him at home at this point, so I'd rather him stay here as well. Right?
I mean, I'll take care of him
Yes.
when I have to, yeah. But this is,
And we'll get the social worker to, before he goes home, we'll get the social worker to see if rehab and those things, or find a way that at home we get a safe environment for you. All right.
but there is a little hope.
Oh yeah, I think there's definitely hope. I mean, obviously, I wish we weren't meeting under these circumstances and dealing with this, but we're in this situation a lot, and I've seen people respond. I've also seen cases where it seems like everything we throw at this, it's just growing like wildfire. But we're not at that. We haven't done anything to treat this. First step is diagnosis, second step is treatment, and then we see how he responds.
Okay.
All right?
You did the biopsies Monday or Tuesday?
Yeah, I think Dr. Judy was looking at mine, probably Monday. And he'll talk to you before.
Okay, great. Thank you so much.
Thank you very much.
Because it's Friday, will he be in today to speak to us about that, or
I'll,
over the weekend?
I'll see if
or-
he, I don't know, no, I spoke to him by phone, I don't know where he is right now.
Okay.
He certainly would talk to you before.
Just because we have a brother that's flying in from California tomorrow who also wants to be here, so we're just trying
He
to give.
probably,
an idea.
Dr. Andrews is here tomorrow, and he probably would be able to talk to you, that's our other partner.
Okay.
He'd probably be able to talk to you as well about it.
Okay.
All right, so what are you going to tell Daddy right now?
The doctor's.
The doctor will
Yeah,
Okay.
let's go talk to him.
I'm sorry.
I was just going over your MRI with the family there and showing them what I see, and, and you're a bit tricky, but I think we gotta figure out what's going on. So, kind of what I see is that there's some areas in the brain that look, they look a little angry, they look a little swollen, and I think this has probably been growing there for a little while or going on, and we've got to figure out what's the way to get this, to get those areas under control. And unfortunately, when we have a tricky situation like this, the only way to really know for sure is to get a piece of it and to do what's called a biopsy. So what we do is make a small incision, and we go in there and we grab a piece of this thing, and then the pathologists figure it out. In terms of what we do as neurosurgeons, probably the easiest operation we do. Just go in, get a piece, and figure it out. Most people end up going home or in a couple days afterwards. So,
Is this a so-called tumor?
well, that's
Or is
one
it-
of.
Or someone was explaining to me there's also something else that's really not a tumor, it's a little more fluffy.
Yeah, so that's a pretty good description. There are all sorts of different categories of things that can look like this. The biggest two that we're worried about is either a tumor or inflammation where the body is attacking itself. And you treat those with two very different types of therapies. So we have to know for sure, because we can't be wrong. We have to go down the right direction. So there's, unfortunately, we've seen this a lot, and the only definitive way to know what it is to get that biopsy. So, we would do it today, but you're on the blood thinners for the heart, so we have to let those gradually wear off for a few days before we can get it there. So my partner, Dr. Judy, was looking at maybe doing the biopsy on Monday or Tuesday, okay? But maybe just hang out here for the weekend and we'll get this done and then we'll look towards getting you home. You got the best view in the hospital. You got the stadium down there, that's all South Philly. So, Sixers are on tonight, I don't know if you can see into there.
Has the college tournament
Yeah,
started?
that's on. That's a good day to be in the hospital. You can watch basketball all day, all right? All weekend. And then I'm going to get the physical therapist working with you because I want to get